Even though it might seem like these days HIV is a thing of the past, it does remain a serious public health crisis with tens of thousands of new HIV cases in the United States every year. Well, fortunately, there are medicines that can help prevent HIV. PrEP Aware Week is an important moment to acknowledge the role that these and other prevention options may play in helping end the HIV epidemic. So here to talk about ways to help prevent HIV is the Chief Scientific Officer and Head of Research and Development at ViiV Healthcare, Dr. Kimberly Smith, joining us now. Dr. Smith, thank you for being with us this morning.
Thank you for having me.
And Dr. Smith, the first question is really just to give us an overview. What is the current status of the HIV epidemic in the U.S.?
Well, as you said, a lot of people think that HIV is a part of the past, but that's not the case. There are 1.2 million people living with HIV in the United States, and there are roughly 32,000 new cases every year. So there's still a significant health challenge, public health challenge related to HIV in this country.
There has been a lot of development over the decades of ways to try and prevent HIV. So what are some of the ways to help prevent HIV from coming in?
Well, we've known for a long time that safer sex and use of condoms can reduce the likelihood of HIV transmission, but the reality is that that hasn't been good enough, and we've continued to have thousands of cases despite that. And so now we have something called PrEP, or pre-exposure prophylaxis. And so there are multiple forms of PrEP, but the form that I want to talk to you about is a long-acting form of PrEP, where an individual can dose once every 2 months, and that can significantly reduce the likelihood of a person acquiring HIV.
Okay, so why is PrEP taking this step instead of where we have been in the past with treatments? Why is PrEP in particular so important?
I think PrEP is particularly important because as I said, we haven't gotten as far as we need to with just condoms, just counseling, and so we needed something more aggressive. And so the multiple options of PrEP that are out there, including daily pills and this long-acting option for PrEP, will significantly reduce the likelihood of individuals acquiring HIV. What we know nowadays is that we can get to the end of the epidemic 2 ways. Importantly, everybody needs to know their status. If you do your HIV test and you're HIV positive, there are great treatments, and people that are on treatment with an undetectable viral load don't transmit to their sexual partners. If you test HIV negative and you're part of some of the communities that are disproportionately impacted, which is Black and Latino men who have sex with men, and actually 1 out of 5 of the new cases is among women, particularly Black women. If you're a part of some of those disproportionately impacted communities, something like PrEP could make a really big difference and reduce the likelihood of an individual acquiring HIV. It's those 2 things together, getting everybody who's living with HIV on treatment and everyone who might be a part of a vulnerable community on PrEP, so that we can get to the end of the epidemic.
And considering the life cycle of the work that you've seen done for HIV vaccines and medications, it is a relatively new thing to have this PrEP standard. So it might be tough to say, but it's worth asking, is there any new research so far, any data to say how this is working, how people are responding to this?
Absolutely. Well, in our original trials that studied this long-acting medicine, we showed that it was significantly better than daily oral PrEP at reducing the likelihood of HIV transmission. This long-acting medication, Apretude, was approved in 2021, but we've continued to do research on this medicine in the real world. And just in the last couple of months, we've shared data at recent medical conferences that have shown that it can be as much as 99% effective at reducing HIV transmission. And so there's a lot of great information for people to have that's out there. If they want to know more about PrEP, they should talk to their healthcare providers, and they can also go to apretude.com to learn more.
All right, that is a good place to start. Dr. Smith, thank you for joining us this morning.